When life gets unpredictable, preparation matters. In medicine, it's all about staying alert, ready for whatever comes through the door. On the road, it's no different. That's why Volvo designs vehicles to help anticipate risk, reduce harm, and protect lives. The Volvo XC90's advanced safety systems inspire confident decisions wherever the road takes you. The Volvo XC90, for life. Proud sponsor of the Pit Podcast. Learn more at volvocars.ca/safety.
Let's talk about pharmacies and pharmacists. We're hearing from some that feel they aren't being recognized for the role they're playing in this crisis, and also the pressure they're under being, public-facing members involved with medical care. Joining me on the line is Tamara. She's a pharmacist in Montreal. Hi, Tamara.
Good morning, Elias.
Good to talk to you. You work at a Pharmaprix, is that correct?
I actually work in 2 or 3 different pharmacies in the Granby and Magog region. One of them is a Pharmaprix, yes.
Okay, gotcha. Okay, sorry about that.
That's okay.
So Tamara, listen, everyone who's listening to us has to go see the pharmacist. It's one of those things. Everyone's got to go see the pharmacist, and I would imagine at a time like this, your role gets amplified. So how has it been? How has the job been over the last couple of months?
Well, I must say it's been a bit of a roller coaster. We're starting to get our feet under us now after about a month of this, but at the beginning it was a bit of a crisis because as everything else shut down, pharmacists kind of had to step in to fill a lot of gaps that were being understandably left open due to other health professionals being called in to prepare for the crisis. So when clinics were closing down for anything that was not urgent, people were turning to their pharmacists for advice. We were also having to change the way we were doing things in order to protect our staff and our patients. So we had to, at the same time that we were dealing with a huge spike in people trying to get all their medications so that they didn't run out, and people phoning and needing reassurance or needing direction as to how to get the care they needed. We are also changing all of our procedures so that we could social distance at work. We are having to install plexiglass and change the way that we controlled access to our laboratories so that we could prevent ourselves from getting contaminated. And we were also giving lots of advice. We were also, the government gave pharmacists expanded role and they relaxed some of the rules so that pharmacists could do more than we normally can.
Yeah, what can you do now? What are the things that have been added to your portfolio here?
Well, a lot of the things we could do already, they've just kind of relaxed the rules. Like, for instance, pharmacists could always, for several years now, we've been able to extend prescriptions. But now they've relaxed the rules so that we could go further than we normally could. So if we could normally only extend a prescription for 1 month, we can now extend it for an indefinite period of time until the crisis is over. Mm-hmm. Before we couldn't extend prescriptions for controlled medications, but now we can evaluate patients and determine if it's a chronic medication that they cannot go without. We are now allowed to extend even controlled and narcotic prescriptions. We have been also given power to transfer prescriptions that we weren't able to transfer before. So if somebody is stuck away from their regular pharmacy and can't get their medication, we can now transfer those prescriptions that we previously couldn't transfer. Mm-hmm. All of that created a huge spike in workload for us.
Yeah, that's it, right? If you download a whole bunch of responsibilities onto pharmacists and people, the pharmacy is right down the street. It's in the community. People are going to show up and ask you for those services. So, what are you seeing when it comes to that?
Well, we're happy to be in the community. We're happy to continue to work and to help our patients. And we've always been very proud to be the most accessible healthcare provider for our patients. And all we ask is some patience that people understand that we are a bit overwhelmed right now as we are stepping in to fill that void, and we're doing our very best. And we are under a lot of pressure because we are being asked to transfer a lot more prescriptions. Like in the eastern townships where I work, we have a lot of people that decided to stay in either their second home or get out of the city to shelter in place while they're doing their isolation, which means that we have a ton of patients that we're transferring prescriptions from their pharmacies in Montreal to the Eastern Townships.
Just what you need right now is like paperwork kind of bureaucracy kind of tasks.
Exactly.
Tamara, I got to ask you, the people that are coming in, and I know there's so many things that have been changed, and hopefully a focus on online ordering and deliveries and that kind of stuff. But have people been respectful coming in? Like one of the things about people that go to the pharmacy, often they're sick, right? So you're dealing with people that, they think, well, maybe I just have a regular fever, a regular flu, and they're showing up. What are some of the things you've gone through so far?
Well, I think we're used to that. We're used to people coming in that have been at the emergency room for, 12, 13 hours, and they're tired and they're sick and they've been up all night with a sick child. But now we're also dealing with people that are sick and tired of being stuck at home with cabin fever, and they've probably stood in line in the parking lot for 20 minutes just to get into the pharmacy. They're a little cranky sometimes, and it's understandable. And I must say that the vast majority of our patients have been extremely grateful to the services we give. It's just unfortunate that sometimes it only takes one negative interaction with somebody to really put your day into a downward spiral, and often we have to just kind of take a deep breath and suck it up and say, you know what, they're stressed, they're tired, they're probably not feeling very well either. Just kind of soldier on. But we have had, I think the most frustrating part for us is when people forget that there are a lot of people in much worse condition than they are, and sometimes we have to prioritize the people that need us more, and others have to wait. So one thing we've been really focusing on is encouraging people to call ahead to fill their refills, to use our online services, to use our delivery service, and to understand when we say, is it okay if it comes tomorrow or the next day? Because our deliveries have gone up quadruple at least. So our delivery drivers have to plan their routes.
Yeah.
They have to. We have to follow all kinds of procedures to protect our delivery drivers, and we're taking information over the phone for payment, and it's just quadrupled our workload.
Tamara, do you need something from the government? Are pharmacists asking for any measures from the government to help you out?
Well, we've been asking for PPE right from the start, while recognizing that obviously the frontline workers in nursing homes and hospitals need it the most. And it's been our pharmacy owners that have been stepping up to the plate and installing plexiglass and having masks made for us. There are very few pharmacies where we can even get the procedural masks, and they're starting to come through. But we've had to content ourselves with using homemade cloth masks. So that to protect ourselves and to also protect our coworkers, and because we have to assume that not only our patients could potentially the virus, our own coworkers could as well. So we have to physically distance within the pharmacy, and we just need. It feels like because we work for private businesses and not for the government healthcare sector, we are often forgotten, and we have to always raise our hands and say, listen, we're part of the healthcare system too, and if you don't protect us, then pharmacies risk getting their teams infected and then having to close, and then people can't get their medication. And it's just inconceivable to ask another neighborhood pharmacy to pick up the workload of a pharmacy that would potentially have to close because their team got
ripple
COVID.
effects. A lot of ripple effects there, Tamara. Tamara, we're awaiting the Prime Minister. We got to go to him when he comes out.
Of course.
But I want to squeeze in a question, and hopefully we can get it in here. Have you seen any shortages of certain types of medications? And if so, do you have any inkling as to why?
Well, first of all, we were always seeing shortages before this crisis, and they have gone up, some artificially, since the crisis began, because our suppliers have had to really monitor and restrict the flow of medication, because as people are trying to stockpile, especially respiratory medications, the demand has gone through the roof.
Anything related, and I just want to get this in here, anything related to the stuff we see from certain political leaders who have been pushing certain drugs?
For instance, hydroxychloroquine, the government had to put in place a directive to pharmacies and doctors to restrict prescriptions for that to very specific groups that absolutely must have it, and because the demand has gone up. But basically it was a preventative measure to make sure that we do have the stocks on hand should we need them. While the studies are going on, that medication is kind of being held kind of in reserve in case it's needed.
Tamara, we got to let you go. You're
Okay.
fantastic. That's Tamara
Thanks so
Begin,
much for having me.
Pharmacist, for coming on the program. Absolutely fantastic.